A Chinese social media user shared a video on February 11th showing that Xinxiao Hospital in Chongqing screened the domestic animated film Neza 2, The Demon Child Wreaks Havoc. The user mentioned that they were fortunate to watch the afternoon showing because the evening sessions were completely packed. Another user commented, "Our company is also organizing a group screening this week, saying it's part of a 100 billion project." A separate video posted on February 9th captured a theater in China packed with moviegoers. Despite the widespread outbreak of influenza A, H1N1, and other illnesses around Chinese New Year, when health experts recommend minimizing large gatherings and strengthening personal protection, Chinese authorities did not issue public health warnings. Instead, they heavily promoted the state-backed film Neza 2, encouraging people to watch it in theaters. Some workplaces even organized mandatory group viewings, and hospitals arranged screenings for staff and their families. As a result, many people fell ill after attending the screenings. One woman reported watching videos for 2 consecutive days, including Neza 2, only to contract influenza A on the 3rd day.
Everyone, you really need to be careful. During the Chinese New Year, everywhere is packed with people, so make sure to protect yourself. Otherwise, you end up like me, stuck in bed for the holiday.
On February 9th, a social media user shared a video expressing shock at how contagious the virus is. Just wear a mask wherever you go. I always thought I was in great shape, that I'd never catch this flu. I remember hearing about it last year, but this year, I actually got it. 3 nights ago, I went to the movies to watch Neza 2. After the movie, I took a cab home, just a 10-minute ride, and that's all it took. I got infected. It's really serious. My God. Another individual recounted taking their child to a Neza 2 screening, where they sat next to a mother and her young son. The child had a severe cold, a runny nose, and was constantly coughing and sneezing. Although the mother had some masks in her bag, she did not put one on her child. The boy eventually fell asleep during the movie after struggling with his symptoms. The vlogger criticized the mother, saying, "As a parent, how could you take a sick child to a crowded theater without a mask? Are you deliberately spreading the virus?" A doctor also weighed in, warning that crowded places like movie theaters are prime locations for cross-infection. He noted that after just one film screening, many attendees ended up catching the flu. The doctor further reported that during his recent night shifts, he saw 70 patients in the outpatient clinic and admitted 8 children, a rate of roughly 1 hospitalized case for every 10 patients. Most of the cases involve fever, cough, or pneumonia. He noted that many parents mentioned taking their children to see Neza 2, and these screenings have become hotspots for viral transmission. The Chinese government's aggressive promotion of Neza 2, despite rising flu infections, has sparked concerns. Given the film's highly ideological messaging, questions arise about whether authorities prioritize propaganda over public health. Neza 2, The Demonic Child Wreaks Havoc, a state-backed animated film, was released in China on January 29 during the peak of the influenza A outbreak. The government claims the film has achieved record-breaking box office success and describes it as the greatest moment for Chinese animation. State media has heavily promoted the film, fueling nationalist sentiment among pro-CCP Chinese social media users. However, even within China, some critics argue that Neza 2 undermines traditional Chinese culture and is filled with anti-faith messaging aligned with the Communist Party ideology. In this adaptation, the mythical hero Neza is portrayed as a demonic child rather than a deity. The film also distorts classical mythology, turning the revered South Pole immortal Nanji Shangwen into a villain and altering the traditional antagonist Shen Gongbao into a positive character. The movie promotes slogans such as "My fate is mine, not the heavens," and "I choose to become a demon, not an immortal," which have been interpreted as anti-faith and anti-divine messages. Some critics argue that the Jade Void Palace, Yushu Palace, in the film symbolizes the Pentagon, and the coveted green badge worn by disciples represents U.S. work permits. This has led to speculation that Neza 2 is part of a broader ideological campaign against the United States. On February 8th, Neza 2 held its international premiere at TCL Chinese Theater in Hollywood. Chinese state media hailed the event as proof that, quote, "Chinese stories are going global." Christian author and Library of Congress invitee Zhang Pingchao noted that the Chinese Communist Party always uses cultural propaganda for two key purposes: to indoctrinate the Chinese public and to attack Western civilization. He stated, "While the U.S. promotes faith and encourages people to seek God, the CCP does the opposite. This film is part of a spiritual battle. Americans must recognize the forces working against truth." Meanwhile, the U.S. government established the White House Faith Office. Australian historian Li Yuanhua likened the film's ideological influence to spiritual fentanyl, warning that its anti-religious, anti-humanity themes pose a threat to global audiences and should be actively resisted. As Neza 2 continued to dominate Chinese theaters during the Lunar New Year, influenza A cases surged across the country. A hospitalized woman described the severity of this flu strain, saying that she initially took her father to the hospital for tests in the morning, but by the evening, she was experiencing body aches, chills, and fever. A blood test later confirmed that she had influenza A.
Now my mom, my dad, and I all have it. We were supposed to take my dad for a checkup this morning, but we couldn't even make it. I've been on the IV drip non-stop, so I really recommend avoiding crowded places and taking proper precautions, especially for kids. Try to keep them away from crowds. This thing spreads way too fast.
今天心情又不是很好，非常沉重。
I'm really feeling down today. It's heartbreaking. I just sent off a young child, and the sound of the parents crying their hearts out is something I can't shake off.
我接触到遗体的时候，
When I handled the body, the child was still burning hot. Later, I found out from the family that it was the flu. The fever wouldn't go down. It went up to 43 degrees Celsius. I can't imagine what that must feel like inside the body. Another TikToker shared that his mother passed away, just like Taiwanese actress Barbie Sue.
这个大 S 去世啊，就是简直跟我妈
Barbie Sue's death is exactly what happened to my mom. It was a flu, which led to white lung, then respiratory failure and heart failure, and she passed away. This flu is far worse than we thought. The moment you notice flu symptoms, get medical help immediately, especially if you're elderly. Don't wait. If you have underlying conditions and you delay even a little, it could be fatal. Trust me, my mom is living proof. I blame myself for not taking better care of her. If only I had noticed earlier, taken her to the hospital earlier, taken it seriously earlier, she could have survived.
儿子感染甲流了。
My son caught the flu, then my wife got it. This morning, I checked my temperature, 37.8 degrees. When will this nightmare end? I just want us to get better soon.
I had a fever of 40.2 degrees for 2 days. Now it's turned into pneumonia, and I had to be hospitalized. This flu is really serious, especially this strain. It hits hard. Once infected, you will have at least 39-degree fever. My son got it first, then me, then my mother-in-law, and now my husband is starting to cough. It's really bad. And for a kid this young, getting an IV in his tiny foot, the needle is so long, it goes all the way in. He was crying so hard. It broke my heart. It's unbearable to watch. Please don't take this lightly. Once one person in the family gets it, it spreads to everyone. Just look at him. His eyes are lifeless, no energy at all. And this is already after the fever has gone down.
A woman who was infected warned that the virus is not just a common cold and shouldn't be taken lightly. She shared that she had been suffering from influenza A for 7 to 8 days since the Lunar New Year, with no signs of improvement. She noted that many people in her hometown had flu-like symptoms, with widespread coughing and fevers. According to her, many people appeared healthy one day, only to develop high fevers reaching 39 degrees Celsius and severe coughs within 2 days. Her husband also fell ill, and her sister initially had a fever before developing a cough. She herself was infected and had been coughing so much that her throat bled. She described experiencing chest pain with each cough and extreme fatigue. She warned that for people with underlying health conditions, this illness could be life-threatening. A viral video showed a family of 5 infected with influenza A. The grandparents were admitted to the ICU, while a child was left without care and had to sleep on the hospital floor at night. The scene resembled the early days of the COVID-19 pandemic. Another video captured overcrowded hospitals, with continuous coughing filling the air. The scale of infections was comparable to the peak of COVID-19.
说实话呀，他们说这个叫甲流。
Honestly, they're not calling this the flu, but it feels no different from COVID, if not worse. Back when I had COVID, I didn't take any meds, didn't get any shots. I just stayed home and got better in a week. But this time, I've been taking all kinds of medicine every day, except for the one they say is a specific treatment. Today is day 5, and I can say I feel a little better, but not really good yet. I still need at least 2 or 3 more days. Since the Chinese government ended its 3-year COVID lockdown, viral outbreaks have persisted. Official reports list various viruses, including COVID-19, mycoplasma pneumonia, adenovirus, respiratory syncytial virus, and influenza A. However, many citizens suspect these infections are linked to COVID-19 or its variants. Political commentator Li Linyi noted that multiple viral infections are spreading in China, but the government's lack of transparency makes it difficult to assess the true situation. It was past 10 p.m. at Huashan Hospital's Hongqiao branch in Shanghai, and the place was packed. I brought a family member to see a doctor, and from registration to actually getting into the clinic, it took over 2 hours. Most people there seem to have vomiting and diarrhea. Maybe it's a new virus going around. I heard this strain is really strong, so everyone, please be careful. The flu outbreak in Shanghai is in full swing now. Just yesterday, my mother-in-law tested positive. That's when it hit me. This thing is right at our doorstep again. What worries me more is that this year's flu seems different. I've already seen a few cases where it led to severe brain infection that causes tissue death. This type of infection has a fatality rate of 90%. Influenza A has become one of the most widely discussed health issues in China, particularly following the death of a Taiwanese actress, Barbie Su, in Japan due to influenza A. In response to rising concerns, the Beijing Center for Disease Control and Prevention recently issued an urgent warning, stating that the city remains in a high-risk period for respiratory infectious diseases. A woman voiced frustration over the high cost and scarcity of influenza A medication, questioning why China is even worse than India and fails to prioritize public health over profit.
My mum and my kid are both infected. I looked up the medicine online. It's insanely expensive. One box costs 250 yuan. The second box, 280 yuan. And there are only 2 pills in a box. An average adult needs 2 pills, but I have a big family, so I wanted to buy 2 boxes, but I couldn't even find them. And it makes me think, what about the poorer people? Can they afford it? If they can't buy it, does that mean they just have to suffer for a week? Don't tell me there are alternative meds. Are poor people supposed to suffer longer? And another thing, why is it that we always talk about overproduction, but when it comes to medicine, there's always a shortage? Back when we needed masks, they ran out. Fever meds, same thing. And now this supposedly effective flu treatment is nowhere to be found. Is it really that hard to produce? I get that businesses need to make money, but stop profiting off poor people's suffering.
She remarked that no one on major Chinese internet platforms dares to discuss the soaring drug prices. While many people perceive India as a developing country, she pointed out that India produces large quantities of generic drugs to lower medical costs for its citizens. Other people have also complained that buying imported flu medication has become nearly impossible.
从过年期间到现在一直都是断购。
I went to 7 pharmacies, and none of them had imported Tamiflu. The flu is spreading like crazy and everyone around me is getting sick. Today I started feeling unwell, sore throat, no energy, maybe even a fever. So I thought I'll buy some imported Tamiflu since it works better. I went to 7 pharmacies, but they only had the domestic version. At first I thought it was because of health insurance policies, but now even private pharmacies don't have it. Then I tried ordering on Meituan. It was 264 yuan, but after I paid, they refunded me. When I checked again, the price had gone up to 294 yuan. No choice, so I ordered from JD's self-operated store for 194 yuan, but it won't arrive until tomorrow. It's just so hard to get imported medicine right now.
Patients have also expressed frustration over long wait times in major hospitals. Some reported waiting 2 to 3 hours just for a consultation, with only 2 doctors on duty in large medical facilities. One patient lamented, "The worst part of being sick is the pain, but if hospitals work more efficiently, we wouldn't have to suffer for so long." A social media commentator noted that while many complain about China's struggling economy and job market, the deteriorating state of the Chinese society and morals is even more concerning.
我们经常听人抱怨现在的经济形势不好。
This flu outbreak is getting worse. I brought a box of medicine I previously bought for 38 yuan to the pharmacy, and when I checked the price, it had jumped to 58 yuan. What can you do? When you're sick, even if the price doubles, you still have to buy it because your life is more important than money. In the afternoon, my condition didn't improve, and just taking medicine wasn't enough, so I decided to go to the hospital for an IV drip. The regular registration fee was 10 yuan, but there were over 100 people ahead of me in line. I couldn't wait that long, so I went to the emergency room. The fee was 22 yuan, and even there, I had to wait behind more than 10 people. While I was waiting, I overheard two doctors greeting each other with smiles saying, "Happy New Year, wishing you prosperity." Hearing that in the middle of all this just didn't sit right with me. A doctor who's also a TikToker shared his frustration about the overwhelming workload since the holiday.
连后天天加班，
I've been working overtime every single day after the new year. The more I treat, the busier I get. I feel like a robot, just repeating the same cycle every day. Work, overtime, treatment, over and over. I'm exhausted, completely drained. Sometimes I ask myself, what's the point of this work? All I do is treat patients nonstop, with no time for research or innovation. In multiple regions across China, people have reported rapid transmission of infections within households, with many cases leading to severe complications such as white lung syndrome, pneumonia, and cardiovascular diseases. Some patients have died suddenly due to complications. However, authorities continue to conceal the full extent of the outbreak, with state media rarely covering patients' experiences or flu-related deaths. There has also been little attention given to the hardships faced by families, hospitals, or healthcare workers. China affairs expert Yue Shan criticized the Chinese Communist Party for prioritizing political and economic interests over public health. He noted that while the government claims its system serves the people, its actions suggest otherwise. As an example, he pointed to authorities promoting large-scale theater screenings during the flu outbreak, showing how they sacrifice public health for propaganda.